Hello folks, welcome to another video. So today I come to you with yet another video to react on. And I kind of like doing this because when you're on TikTok, like when you're scrolling on your For You page, you come across a lot of videos that I know doesn't reach a lot of people. Okay. I know some people like to be on YouTube. Some people also prefer to be on TikTok because they get exposed to a lot of videos. But I have made my For You stream up For You page in such a way that I come across videos that I want to see. Okay, so the videos that I bring to you are the ones that I feel like my audience on YouTube haven't seen. Even if they've seen, like, we all have stuff to talk about. So I just bring these kind of videos so that we can all share our thoughts on them. So this particular video I'm bringing to you today is a lady who I think was or is a health professional, and she went through something that actually made her a patient. So it's like roles were switched. Now she was going through stuff that patients went through, and then she's seeing like the other side of the whole thing. I'm just gonna start to play this video, and then I would love for you to share your experiences and your thoughts in the comment section about what you think about this. Let's get to it.
I was debating even talking about this, but I had the worst experience with medical gaslighting today. I spent most of today trying to calm down, and my eyes are no longer puffy from crying. I've been seeing the same specialist for the last 10 years, and I've always tried to keep up with my appointments, to be on time with my screenings, and for the last 10 years, up until 2020 and 2021. I'm a nurse, and in 2020 and 2021, I completely neglected my physical and mental health.
Okay, let's just pause it there. Right, so she has kept the same specialist for the last 10 years, which is normal, because I know even here in the UK, your primary care, your first contact is with your GP, which you keep for like a long time, depending on where you live. That's if you continue to live there, that is your GP. And then sometimes you are lucky to be seeing the same person for like a long time. Sometimes you go in and then maybe they change the person, but it's just the same GP. That is where your records are. It is actually a good thing to keep the same specialist for a long time, because then they have your record, they keep following up, and they know like how your recovery process is going. And then she mentioned that she is a nurse, and obviously, she has neglected her physical and mental state, which is kind of normal because I know how the profession can be overwhelming sometimes. You love what you do, basically, so you tend to forget about yourself, which shouldn't be the case, because I think, or I believe, that for you to be able to take care of others, you should take care of yourself first. As the Bible says, that love your neighbor as yourself. Okay, so you love yourself and then you'll be able to love your neighbor. All right, not love your neighbor and hate yourself. So you should just take care of yourself. Okay, this profession, it's a bit difficult, that if you tend to neglect your physical and your mental health, it will go a long way to affect the way you even care for your patient. So now your intention of caring for your patients with all of you, like, what will be left of it? Okay, so we are not too far gone into the video, but I would just like to encourage you to like take care of yourself. This doesn't apply to only health professions or like only medical professionals, but I would say to everyone else that is working in a different field, anyone dealing with customers, anyone like who is in the like front line to customers, please try and take care of yourself before taking care of your customers, because it will go a long way. If you are happy, they are happy. If they're happy, you are happy.
So I'd followed up with a specialist in 2021, and I was supposed to follow up within a year. At the beginning of last year, I suffered a spinal cord injury and ended up needing surgery.
Okay, sorry for pausing it too quick, but yeah, I just heard that she said she had a spinal cord injury, which is common with health professionals. I would say again, because I know I've seen and I've heard stories of people complaining of their waist, their back, like people working in hospitals, in care homes. I used to work in a care home, and I know how it feels to, actually have these kind of problems. I remember I had a colleague who had to stop working at some point because she was down with a back problem. I think that was exactly what this lady was also going through. And it is, trust me, it is so painful. So painful. It doesn't matter. I don't know, like the type of spine injury that she had. It might be a slipped disc. That is when, like, there are discs in between your spine that helps it to not slide over each other. It helps to cushion it. It helps, and it helps with easy movement of the spine. So if one of these discs, like if it slips out or if it slips in, it is actually, it's mostly, I think the most common way is it slips in and is actually going to compress your spinal cord, because you know that your spine houses your spinal cord. But if it slips in, that is when you tend to have complications. You tend to have pain. Sometimes you have pain shooting down your legs. It depends on where the slipping in occurs, because every level of the spinal cord has nerves that are coming out of it, and then these nerves supply specific parts of your body. So I know people having nerve problems explain to us that they are going through excruciating pain, which is like a really, really bad pain. So I don't know I don't know the kind of injury she had, but I can tell you that it was assumed to be very painful. Just take care of your back. And trust me, we have this topic in our module called taking care of your back, which I think we did in first year, because they know the kind of work we are going into, and then they know like how we're going to care for patients and all. So they are teaching us how to take care of our back before taking care of patients. And it was one of the first topics that we ever did in med school. So please take care of your back. It doesn't matter what you're doing, but just take care of your back.
So my recovery was a big part of last year, and I had lost track of everything else in my life. After my surgery in August, I had new symptoms that I needed to address with that specialist, and it was just around the 1 year mark. So I called them to alert them to the new findings, and I set up an appointment with this specialist. So I made this appointment for August of 22 to follow up, and then I get a call a week later that I have to cancel my appointment because I need updated imaging, which was fine. I had updated imaging done, which was ordered by the specialist in September of 2022. With this imaging, I'm told to follow up in 6 months. So here we are in February. There were a couple other things that made me not follow up sooner, but I called them today to follow up on the ultrasound that they'd ordered for me to get so that I could be seen in the office. But what I met with over the phone is, you haven't followed up with us in 2 years, so you're gonna have to go to your primary care provider or whoever ordered this ultrasound, have them review it and refer them back to us if you want to be seen in the office.
No, God, that was too much. So that was in the space of 2 years. No. So, okay. So if I heard her right, she was told to follow up after a year. And then after a year, she did it. And they said, no, she had to cancel the appointment because she needed imaging to confirm whatever that was going on. So that was scheduled for like 6 months' time. Right. She did the imaging. And then after that, I think she was supposed to call them back after another 6 months. And then she did, and they said, no, you haven't followed up in the past 2 years. So you'd have to start the process all over. No, this is actually, like, even me talking about it is stressful because, yeah, I know how these things can be. There are like systems, and there are like, it's just like systems that you go through before you're able to see a specialist, basically. Here in the UK, your first contact is your primary care, that is the GP. So let's say, I don't know, I'm just going to use this lady's experience as an example. So you see the GP about your back pain, and then when they feel like it's something really severe that you'd have to be referred to a specialist, that is when they do, because they'll take you through some maybe questionnaires, and they'll do some examinations and all that, and then they feel like, oh no, you need to see a specialist. Okay, fine, we will refer you. The problem with the NHS right now is the waiting time. It's really long, a long queue. I don't know if I don't know if it's the queue, or I don't know what's actually going on in the system, but the wait time is just too long. You could get a wait time from between maybe a year or two. So just imagine, after a year, as she said, she waited for the year for it to be her turn. She tried to book the appointment. Now they said, oh no, we cannot book the appointment for you. You would have to cancel the appointment because you need imaging to confirm whatever that's going on. Fine, fair enough. We are in the process, right? Yeah. Imaging is part of investigation. Good. Now she books imaging, gets it done. And then, fair enough, she admitted that, yeah, there are some delays here and there. She calls back that, okay, the imaging is done, the results are ready. And then now, I think I'm ready to see the specialist. And then, so that was like 2 years gone. And then you tell her that, oh no, we're really sorry because you didn't follow up in the past 2 years. So we have to start the process all over. Mind you, this person is still going through the pain and she's enduring it. Okay. Whatever she's using to managing the pain, we don't know. But yeah, she shouldn't be on, even if it's like painkillers or whatever, she shouldn't be on it for long. We have to find a solution for her. You are trying to tell her to start this process all over. She has gone through that 2-year period enduring this pain. So she should go through another 2 years to endure the pain. My sister, I feel your pain and I understand why you're crying, because this is painful. Even me talking about it right now, I have never felt the pain you are going through, but it's sad to talk about this because you thinking you would get help from the people that, or from wherever you've worked in the field before, so you know how things run, you know how things work. So you thinking you would get help, you were not exempted, and you were going through it. So now you would understand what patients go through when they come to the hospitals ranting and being frustrated. I did a video last week talking about, it was also a review video. It was a Black lady who was frustrated about the healthcare system because she was a patient and she didn't like what was going on. And she even eventually died. So now you are being a patient and then now you're getting frustrated because of how the system is going. You understand? Yeah, this is sad. It is sad because the pain she's going through, I understand it. It's a really bad pain. But yeah, starting the process all over, I don't know.
And I am so confused because I had followed up last year, 5 months ago, but I was told, nope, you haven't followed up with us in the last 2 years. And also you canceled an appointment and you no-showed for an appointment. I tried my best to calmly explain to them, one, I canceled an appointment. Yes, this is true. But they'd also canceled my appointment a couple months back. And the reason I no-showed to the appointment that I'd made in August was because I was having surgery that week and I forgot.
Yeah, I know. A lot of things will make you forget your appointment, especially when you have a lot going on. But my question is, they are saying you have not followed up in the past 2 years. Was nobody keeping records of, what was going on? Again, I spoke about record keeping last week. I'm going to talk about it again. Yeah, I am not perfect, okay? I can also make a mistake of not keeping records. But then the system that we find ourselves in have trained us to keep record of every single thing, every detail. Records have to be kept on you canceling your appointment. Because if I heard you right, you said you canceled one appointment and they canceled your appointment because I believe that was when they asked you to go and take the imaging. And then, yes, anything can happen for you to cancel your appointment. Okay? It is not compulsory to go for your appointment if you have a set date. Anything can happen the morning before the appointment that can throw you off. So it's good you didn't cancel like a lot of appointments and it's just one. And then they canceled another appointment because they asked you to go for the imaging, right? So all these things, all these records had to be kept on your file, on your profile, wherever they keep the records. You're going to start all over. It's kind of sad because why would you, like, you're still going through the pain. You are going through the pain. You have to be seen by a specialist. I'm just going to keep on hitting the nail on its head on record keeping. And then, yeah, at the end of this video, I would like to ask you, who do you think is at fault? Is it the medical professionals at the back end or is it the front desk? Because obviously when you call, who picks up? Whenever you're calling to speak to these people, I believe it's the front desk. I don't know if they are not in, like, they don't have access to your profile. Or I don't know if they are, I just don't know what's going on. Okay, so I can't really say much. But
It wasn't even about the scheduling thing, it was just the way that I was spoken to. And also the gaslighting, because I had followed up within the last 2 years. And I tried to provide the context, but I was being berated over the phone. I've had appointments canceled more times than I can count, but in the last 10 years, missing 2 appointments is enough to retaliate against a patient, have them jump through hoops just to be treated.
So in the last 10 years, you've cancelled just 2 appointments and now it feels like you're being punished for it. But before the last 10 years, you've cancelled a lot of appointments and you didn't really see anything bad, or nothing really happened, because right now you're going through that pain, so you feel frustrated. But I'm not saying it's not a good thing. Actually, it is not a good thing, and I understand the way they spoke to you. That is even what has made you angry. That has made you frustrated because, yeah, they're not addressing you properly. Obviously, it depends on the person talking to you. It depends on whoever that is at the other end of the phone. I'll keep saying this, just the way we talk to people, especially when you're into business, especially when you're interacting with customers, with patients, the way you talk to people, okay, can make and unmake their day. As I said at the time, please, if you are frustrated, do not take your frustration to work, because you don't know whose mood you are actually making bad. I know you don't care, but at least have some empathy in you, have some compassion in you, that you are there to serve patients, so you're not there to ruin their day. This lady, as she said, it's not even about the appointment she cancelled. It's not even about they telling her to restart the process. It's about the way she was spoken to and the gaslighting. Okay, we are almost through to the end of the video. Let's just listen to the last part.
I was in tears over the phone and they just got angrier with me. I wasn't picking a fight, I was just trying to be understood. And we wonder why people struggle to seek care.
Right, so as I said, the gaslighting. So why would you get angry at her? Because it wasn't even her fault that she cancelled an appointment, or an appointment was cancelled, because it was cancelled for her to be for imaging, which was part of the process. So why would you yell at her on the phone just because she missed 2 appointments? Please, let's try and do our work really well. let's try and make patients feel better. Because you wouldn't know where you would be. You wouldn't know. Right. Calm down. You wouldn't know who's going to take care of you in the future. You wouldn't know how your situation is going to change. I'm not saying this lady is a nurse. I'm not saying she didn't treat her patients well. Who knows? Maybe she did, because most of the time it's just the good ones that go through bad stuff. Okay? But the other person at the end of the phone, just remember that you're also human and anything can happen. The tables can turn. If you want to be treated well, please treat people well. Because at the end of the day, you just wouldn't know who is going to take care of you. You wouldn't know who would be on the other side of your phone to talk to you. I understand maybe the lady, when she was talking on the phone, she was a bit frustrated because of the pain she was going through. But it is your duty to actually calm them down and explain things to them. Oh, okay, maybe. Oh, I'm really sorry, but this is what I'm seeing on the system, that you've cancelled 2 appointments. So because of that, I'm so sorry to tell you that you'd have to start the process all over by going to see your primary care first. Something like that. Just explain that, or maybe this is our policy. This is how things are done. It doesn't matter if she's worked in the system for long. Maybe she doesn't even know these kind of things. Even if she knows, okay, she's now the patient. Still take her through in a calm way. Try to calm her down as well, because she's going through a lot. But you yelling at her and she being in that pain, obviously, 2 wrongs don't make a right. It's going to escalate and it's going to be something else. So, my dear healthcare professionals, not only healthcare professionals, my dear everyone, let's be mindful of the way we treat our customers and our patients. Let's be mindful of the way we speak to customers, especially when you are at the front desk. Customer service. Be mindful of the way you talk to your customers, because you wouldn't know the position you would be in the next 5 years, in the next 2 years, in the next hour. People would have to take care of you as well. And people taking care of you, I'm not saying that health-wise. Could be you being at the shop and being attended to, people still taking care of you. So let's just be mindful of how we approach situations. And I'm really sorry, love, because yes, you'd have to start the process all over. I don't know, something went wrong somewhere, and yeah, if you would want to see like a private care, which I know would be really expensive, because I know private people, they are good with these kind of things, keeping records and trying to follow up on their patients, because obviously the government has a lot of people to deal with. But I'm not saying they don't attend. They attend to a lot of people. They attend to people still. But if you feel like the pain is still really bad to handle, I feel like you just seek help elsewhere. And yeah, that is it for today. Let me know if you have your opinions or your experiences or stories people have shared with you. Just let me know in the comment section. Let's talk there as well. This video doesn't end here. Let's just continue the conversation in the comment section. So that's it for today. Thank you so much, and don't forget to subscribe, because I know I've been getting a lot of views, but it doesn't match up to the number of subscribers. Please subscribe. I'm pleading with you. Please subscribe, so that we would always have the zeal to come with new videos all the time. Okay, so stay safe and catch you up on the next. Bye.